Please stop talking at this point. We'd like to bring the meeting to order. Thank you.
Okay. Chair Barish,
Here.
Sheriff Allman, Member Angelo,
Here.
Member Liberty, Member Riley,
Here.
Member McGordy, Member Miller,
Here.
Member Weir,
Here.
Member Diamond,
Here.
Vice Chair Muschetti, and Member Myrtle are absent by prearrangement.
First of all, Jason Wells couldn't be here because he's in an important meeting that he was required to attend, but he asked that I welcome everyone to Howard Hospital. And the first time we've had it outside of our county buildings, but it's nice to see everybody in our conference room. To begin, we would like to invite members of the public to speak, and we have some requests. First, Larry Stopes.
Hi, I'm Larry Stopes. I live on Sherwood Road, just outside of Willits. I have a number of concerns about this whole process. I just feel like things were moving along in a certain direction, and then all of a sudden, bureaucracy got in the way. So I'd just like to know, as a citizen of the public, where do we stand on this thing? What is being done to move it ahead quickly? After 35 plus years of business experience, I learned the value of working with a sense of competitive urgency. I don't see that here at all, and I'd just like to have you all address that, if you would. Thank you very much.
Thank you. I have a request from Sylvia.
Hi, my name is Sylvia. Sorry, forgive me for this.
State your last name, please.
Sylvia Clark. So I have had some recent experiences. Well, I've lots of experiences with mental health crisis with people close to me. And with undertrained first responders. So my concern and hope is that with Measure B, besides the brick and mortar funding for all this, that there will be some sort of more training emphasized on nurses, all first responders, police officers, sheriff's department. If there's going to be any collaboration with mental health. I watched something really important to me last night. It was an eye-opening. It was called, now I forget what it was. Ernie and Joe. They are police officers in San Antonio, and they have a crisis unit. They have created a crisis unit. It was very eye-opening. So I'm hoping that there's going to be some sort of collaboration with first responders and mental health crisis counselors. All right, because people just want someone to show up and care. That's all. So thank you.
Thank you, Sylvia.
Excuse me. Let the record show that Member Liberty has arrived. And Jan McGordy.
Nika Huffman.
Yes, sir. I'm Nika Huffman. I live at 71 Madrone Street behind the old hospital. Don't talk too loud because I'm missing one vocal cord. In living up there over 40 years, the hospital has been a real blessing to all of us. But now that it's gone down, I want to commend the committee for choosing Fort Bragg and the Ukiah for trying to put our mental health at ease so they have a place at 2 places. The hospital isn't worth that. It could be annexed into the Adventist for other purposes. For beds, for exactly. If you annex it, we could have extra beds for some of these people. My husband just died this year. There was no room here. He was transported to St. Helena, then to Ukiah. The one question my husband asked me was, "Mama, please take me home. I love you." And working at Talmadge State Hospital many years ago when I was 19 years old, I can tell you working with the mental is not an easy task. Up there on our hill, we have schools, we have children. It was said that in one of the letters to the editor that the school was 2 blocks away. Sir, it is not. I can look through my kitchen window and see the entranceway to the Howard Hospital. I can walk to my living room through the next door, and I can see the school grounds, I can see the cafeteria, and I can see the band room. Things that I seen at Talmadge Hospital were people waiting outside to get in, things that they called bush therapy. I won't go into that. But having it over at the coast and Ukiah, you're spreading things out so the mentally ill can get help, and I want to commend you on that. God bless you. Thank you.
Thank you, Ms. Huffman.
Hi, I'm glad that you're having this here. As you can see, there's a lot of interest, and I want to commend all of you for being on this committee. It's no doubt that you're deeply interested in the mental health of our county, or you wouldn't be here. I'm speaking from the perspective of having a son that lived here in this county for 12 years, and how limited our resources are. Doesn't mean that our people don't deeply care. They do, so very much. Maybe more than any place I've ever been, but very limited resources. And he even had a psychiatrist wanting to hospitalize him, wrote a letter. We took him into emergency. It just wouldn't happen here. It just wouldn't happen. So even though he could get hospitalized when we lived in Sonoma County, there was a hospital there. Of course, now there isn't. They're working on that too. So I just want to see something happen. And we had someone die from the cold, most likely a mentally ill person, just this last week in our county. And there's going to be more people dying on the streets if we don't have services. So my big concern is how long it's taking to get things going. I mean, I do understand that you have to have a location and there's due process, but I also understand that we had something here in our town that was close to being ready to go that said we could actually get it done in 18 months. I wonder how many people are going to die between now and when we get something up. That doesn't even mean the people that are needing services. My son is now in Modesto getting services that he so desperately needed. So my greatest concern is how long it's taking us to get this going, how very, very long it's taking. And so now we've chosen a piece of property, it sounds like, and we've got architects or whatever. It looks to me like it's going to take maybe 5 years. How many people will we lose in that length of time? That's my concern. And again, I want to thank you for your work. I was on the County Mental Health Board. It's thankless jobs to do this. People are more than ready to tell you what isn't working and what you're not doing, and rarely ready to tell you how much they appreciate the work that you are doing. So I want to tell each and every one of you that I deeply appreciate the work you're doing. Thanks.
Thank you, Ms. McCabe. Emmy Good.
Hi, folks. Thank you for allowing me the opportunity to speak to you today. I'm going to read this to you because I realize that I only have 3 minutes and I want to keep it to 3 minutes. And it's called My 3-Minute Vision. When I heard that Measure B had passed, I instantly thought about the many people who could be helped and the kinds of services and programs that could be undertaken. Knowing that the old Howard Hospital was a possible location really inspired my imagination. There are many mental health services that are required for a very diverse group of children, adults, and families with mental health concerns and problems. These are being addressed in your reports. I am here as a member of the community who wants to address a picture that includes more than buildings. Let me share with you my dream. I have a vision of the old Howard Hospital transforming into a Howard Mental Health Center with whatever care and treatment services are deemed necessary, of beds available if needed for residential care. There are 5 entrances, 38,000 square feet, a kitchen, and all kinds of space that can be developed in ways that would best serve the county and the 3rd District. There is a kitchen, there are spaces and rooms that can accommodate many different possibilities. But I was thinking about more than the health, I was thinking more about the health part of mental health treatments, and I would like to put the treat back in the concept of treatment. Feeling good is the greatest gift that we can give ourselves. Laughter heals. Do you remember Patch Adams? See the movie with Robin Williams. Patch visited our community years ago, and he reminded us that laughter is good medicine. And I know that this is a serious subject, but seriously, I think we can get excited and happy that many ideas do not cost a lot of money. They just need a physical space that is welcoming, warm, healing, and caring. These are some of the things that I think that we can do to promote a mentally healthy community. As a former teacher and business person with interest in art and theater, I have seen the transforming power of music and the arts to promote good mental health in children, adults, and families. I have also noted the importance of good nutrition, eating well, practicing knowledgeable self-care. Exercise, relaxation techniques, and breathing practices can help with impulse control and help people feel better. Moving, dancing, singing can lift the spirits. Experiencing art and handcrafting can soothe the soul. And just imagine classrooms, rooms in the old Howard Hospital with unlimited groups and classes related to any and all kinds of activities that promote good mental health. Many in our local community have talents that they would be happy to share on a volunteer basis or through grant funding. However, what I am talking about is not very expensive compared to having to treat someone who is severely ill. Let's use some of our energy to promote good mental health. It's contagious. Most of us, at some time or another, have to deal with extensive challenges, either personally or related to family and friends. It would be reassuring to know that all of us could go to the Howard Mental Health Center for help and treatment if needed. Thank you.
Thank you, Ms. Good. Beth Rydell.
Hello, I appreciate all you are doing. I know that this is often a thankless job and it's hard to, there's many aspects to this that have to be dealt with. I appreciate looking at possibly having the hospitals take care of the more dangerous and the scarier people that need help. But I also think that if we can use the Howard Hospital, it would be another relatively quick solution that would also be cheaper, which I think money really matters to all of us in this whole process. We're not a super rich county. It is a big enough facility that it has more options. And I did look at the property down on Orchard Street, and basically you have to put a parking lot near the place, and it's not that big. I don't see how, unless you put a skyscraper there, how many different types of services you can put in there, actually. And I realize that personnel is important, but I just think that knowing that our superintendent of schools says that it's fine for the school area, that this would work really well. It's I mean, I realize the people in Gualala and Point Arena, it's far wherever you put it. But for the most part, if the weather is as terrible as it has been and as the roads go out, they almost have to go up the coast and come over to go down to even get to Ukiah. So I see it as being relatively centrally located. And it just seems to me that looking at all the possibilities, it makes more sense to me to do something that we can get going faster and that will ultimately cost us less money. Makes sense to do. We're not a rich county, and that building is pretty amazing with all the possible options we could have there. I just hope that you are all looking at that as an option as well and realize that I really appreciate it when we use the buildings that we already, that are pretty much together, and that actually some of the buildings the county owns. I think that makes much more sense than always going and building something from scratch, which in this day and age is exorbitantly expensive. But again, thank you for looking at all the options, and I appreciate your work. Be well.
Thank you, Ms. Riddell. Is there any further public expression?
Do you need a card? I didn't want to. All right. Hi.
State your name.
Hi, my name's Mika Ferretta, and I just wanted to point out that Jan McGordy is retiring from the Behavioral Health Advisory Board, so we'll be electing a new representative for the Measure B Board, and I wanted to extend my thank you to her. We had a meeting earlier today, and I wanted to give you flowers, but it was a little early in the day, so I just wanted to give them to you now and say thank you very much.
Thank you.
First of all,
Could I have you state your name, please?
yes, Jonathan Davis down in Ukiah. First of all, I'd like to reassure Carmel that I have no intention of shrinking her head today or anybody else's head today. If anybody remembers that. If anybody tries to remember that from 2 months ago. And I'm sure that Jed here doesn't even like the term, what he does. He doesn't do that. He expands people's heads. He tries to integrate their personalities, whatever station they're at. And he's quite successful, and that's why he's here. Blessings. Frank Wilczek, Nobel Prize winning physicist, once stated, if you don't make mistakes, you're not working on hard enough problems. And that would be a mistake. And I remember, working on mental health issues. Real tough stuff. But we're doing it now, and we should congratulate ourselves. Really glad this table of wonderful people working on it step by step. I remember Cal State Northridge. I had to take a final the day after. I had to take a midterm the day after Martin Luther King was assassinated. I had to take a final the day after Bobby Kennedy was assassinated. I had to, shook his hand no more than a month and a half before he passed on, for his assassination. But I always remember he used to list a litany of problems, on his campaign speeches. And he would always end with that great, inimitable Bostonian accent. I think we can do better. And indeed, we do need to do better. We must do better. We are doing better. I was hoping to bring up some other issues, more relevant, another time. I really would like to make a personal kind of one of those little things, anecdotes. Sheriff Allman, don't be embarrassed. I'm going to bring up something from a couple years ago. We talk once in a while here and there. At one of the last Michael McDonald's fundraisers for the Rural Health Rocks concerts. It's down in Ukiah, Mendocino College. The lights are about to go, well, maybe another 15 minutes, half hour. We spot each other in the aisles. And he notices I'm carrying a couple of albums of some of the guys that are on this rock thing. And I tell him, yeah, the Byrds' greatest hits. Doobie Brothers' greatest hits. A couple of other albums. He says, are you going to try and get those signed or whatever? Yeah, sure, if I can. He says, well, probably good luck. He did something completely out of the ordinary, which he does all the time. Talk about compassion, talk about personal touch. What did he do? He grabs my albums without any arrogance, and he goes backstage. He is the master of ceremonies for this upcoming concert. And he goes backstage and gets these albums signed. This is before he even goes on. He's master of ceremonies. He has to introduce every one of these rock groups. And you'd think he'd be preparing all the way. He comes back. Album signed. I mean, unbelievable.
Mr. Davis, I'm afraid. we're
Okay,
gonna-
yeah. But at any rate, I just wanted to let you know, this is the character of this man here, and we appreciate him. Compassion and a touch of the personal. Thank you so much.
Thank you, Mr. Davis. Next, Mr. Weir will give a discussion, possible action regarding the expenditure report on the Measure B tax funds.
Thank you, Chair Marsh. Lloyd Weir, Auditor Controller. This is the current monthly report for the Mental Health Treatment Act funds. As a reminder to everybody, these are deposited into a special revenue fund, which is restricted outside of the county's general fund and is in a fund all by itself. Expenditures out of this fund has to be approved by our Board of Supervisors. This marks our 18th month of monthly sales tax proceeds, beginning in April of 2018 through September of 2019. We have collected a total of $12,463,353. The expenses from May of 2018 through November of 2019 total $521,723. We have also earned $113,869 of interest on our funds. So currently in the Measure B fund, the balance is set at $12,055,499. I also included a 3-page report, a budget report. I think I'll save that for the budget item later on in the meeting. That's all I have. Thanks.
Thank you, Mr. Weir. Ms. Riley?
A question for the auditor. Do you have any information or idea why September 2019 is more than 30% lower than September 2018? Is it possible that that's incomplete collection or something else going on there?
So there are a couple things happening at the state level. Through all this, they transitioned to a new computer system. So people were not able to log on and make their payments a timely manner. So there was a little bit of catch-up going on. So it's kind of hard to compare one month to a previous year. But there eventually did catch up and all taxes got paid. So it's just going to look a little, higher in some months and lower in others.
Ms. Angelo?
Thank you, Chair Barsha. My question for the auditor, I apologize, I looked at this last week and then I didn't call you, but under the expenses for October 25th of 2019, you have CEO labor and benefits for $2,986. Could you please explain what that is?
Yeah, so the activities of the Measure B committee are sometimes conducted in the executive office by staff that is paid through the general fund. In order to accomplish the Measure B activities, that every once in a while that we'll generate a billing for one of the staff members to work on our items. And this is because we probably didn't have our manager in place and we needed to make sure that certain work got done on a timely manner. So occasionally Measure B will receive a bill from a department like that doing work for the Measure B committee.
So Auditor Weir, thank you for that clarification. I'm thinking when I look at the cost here, the cost has been Lee Kemper, Sally Riley, Nash Gonzalez, all the consultants that worked on the RFP. So is it safe to say that almost $3,000 was work that the executive office did on the RFP?
That's
Because we don't
probably
charge for our
probably
time
right.
here.
Yeah,
Okay.
I don't have that detail.
Okay. All right. Thank you.
Mm-hmm.
I'd like to invite public expression.
Public expression, even though you haven't signed the slip, the slip.
No, that's okay.
All right, I'm Keith Peterson, and I own a house adjacent to the old Howard Hospital site. And I've had some real problems while the Howard Hospital was located there regarding parking, noise, light pollution. And my understanding is you're planning to put a secured facility for these mental health patients, is that correct? Like a fenced facility, somewhat similar to a jail, is that correct? The proposal is? At any rate, having a facility there's not adequate parking, okay? When Howard Hospital was there, my house was severely impacted by cars from morning until night. I could not park in front of my house. You do not have enough parking for that facility so that you're not impacting the residential areas of the neighborhood. Because all the employees are parking out on the street, the maintenance crew who cleans the area would have to start, almost before daylight to start blowing the leaves and picking up whatever. So the noise, it was incredible. And right across the street from me is the air handlers, the trash compactor, and all that stuff is making noise 24 hours a day. And I'm assuming that would be the same. The light pollution from a facility where you have this type of activity, I'm assuming you'd have security lights. And if you could do something to restrict the lights going out all into the residential areas and the noise, and increase the parking on site so that everyone who comes to the facility, everyone who works there, and all the vendors and whatnot are not parking in the residential areas. Those are my concerns.
Thank you. Next, I'd like to move on to,
Sorry, I have to leave, I'm sorry.
I'd like to move on to approval of the minutes.
Chair Barish, Paul Wallman, I've read the minutes. I'm going to make a motion that we approve them as submitted.
I'll second.
All in favor, please say aye.
Aye.
Opposed? That motion passes. We will approve the minutes Next, moving on to item 3C, discussion and possible action regarding update on Measure B project manager. Ms. Angelo.
Okay, yeah, great, thank you, Chair Barish. There's a history here, the background on the Measure B project manager recruitment. It has been a short time, but we have Measure B project manager, Isabel Gonzalez, and she is here today. Isabel started on December 9th, and this is her first Measure B meeting. And so I will ask Isabel, please, to introduce herself and tell the full committee and the public a little bit about herself.
Hello, everybody present, committee members, chair, council. My name is, as Carmel mentioned, my name is Isabel Gonzalez. I'm definitely, excuse me for saying this, but I'm 100% Mendocino illiterate. I've just relocated here with my husband, who is in law enforcement from San Diego County, and I look forward to working with the committee and getting to know and listening to some of the concerns in the future. At the moment, I am currently getting to know the policies and regulations for this county, in addition to getting up to date on everything that has to do with Measure B. I have experience working in the private federal sector, private nonprofit sector, private federally sponsored nonprofit sectors. I am new to this sector, so I'm being honest with you. If you want to come and introduce yourselves, just say hello to me at the end of the meeting. I'm open to that. I will probably not be the adequate person today to answer any of your questions, but I can definitely take the time to get to meet you and listen to you if you have anything you want to express. It's nice to meet you and nice to be here.
Thank you. I would like to invite public expression. Well, first, the committee, Jed.
Thank you. I just wanted to welcome you as well and look forward to getting to know you more, as all of us are. I just wanted to make a point of order with the chair so everybody understands this is a new setting, a lot of people here for the first time. I believe it's the protocol that we have open discussion at the beginning of the meeting, and then as we get into the agenda, there's open discussion from the community that is specific to that agenda item so that we, can keep moving ahead and not get way behind. Is that my understanding?
That's correct.
Thank you.
So I would invite public expression on the topic of the project manager.
My name is Bill Barksdale. I wasn't going to speak today, but I want to welcome you, and I'm grateful that there is a project manager at last. And I hope you get up to speed and use some knowledgeable guidance of your own, as well as gathering information. I was distressed when I read that the Board of Supervisors had approved a $3.3 million approximately budget for architectural advice without the guidance of a project manager. So I'm grateful that you're here, and I hope that the expenditures get a bit more rational and under control. I keep thinking about what would Mr. Rogers say, so I do want to say thank each and every one of you. I really appreciate what you're doing.
Thank you, Mr. Barksdale. Seeing no further public expression, I'd like to move on to agenda item 3D, update regarding December 10th, 2019 Board of Supervisors meeting regarding direction to perform an operational feasibility study of proposed Measure B funded facilities.
Chair Barish, thank you. This item on December 10th, there was an agenda item brought to the board by Supervisor Williams, which was a request that the board give direction to staff to do an operational feasibility study of proposed Measure B funded facilities, which is what you have here. And part of that direction was to start with working with Adventist Health to determine the cost of a 24-hour inpatient psychiatric facility operated by Adventist. What you have attached to item 3D is a letter written by the president of Adventist, Jason Wells, to the Mendocino County Measure B committee members. So you should all have this letter, and it is a public document. Supervisor Williams did speak to the operational feasibility study and also his communication with Adventist, and of course the letter as well. And so the intent of the board from this meeting is that as we move forward and we look at facilities to house services, that we step back and we look at the operations and the cost of operations. And what we know based on the Kemper Report and also what this committee has discussed is that there's three different service models that we've been looking at. One, of course, is what we have called a PUF. And a PUF is a standalone. And the reason that we're calling this a 24-hour inpatient psychiatric facility is that it becomes part of a hospital. So it's not a standalone, it's not a PUF. But the service, as I understand it, is really the same. You're talking a locked facility for psychiatric patients, and it's a 24/7 facility. So what we have been looking at is the cost of building or renovating a facility for a PUF or a crisis residential center and a crisis stabilization unit. So those are the three services, and you'll hear a little bit more about that later in this agenda packet when we talk about the architect contract. This item and my direction, and remember, as CEO, I work for the 5-member Board of Supervisors. I take my direction from the Board of Supervisors. And that direction is to begin the process of an operational feasibility study on these services, and to begin by working with Adventist Health. So I did meet with Mr. Wells last week to discuss the board direction and the possibility of a proposal coming from Adventist Health. And Jason believes that we could have a proposal from them within 60 days. And you can see if you have the letter, and if you don't have the letter, it is online, and I don't know if there's any copies in the room. But basically, Adventist Health talks about designating beds that would be specifically for mental health and working with the county to renovate the hospital facilities to do this. So this item is to inform the Measure B committee what my direction has been from the Board of Supervisors, and that we are beginning that process. I am waiting for a proposal that will come to me from the Adventist Health system, and then we'll go from there. In the meantime, there was a request to take another look at Lee Kemper and pull Lee Kemper in to look at any proposal that we would get, and also the operational feasibility. And Miss Tammy Moss Chandler did speak with Lee Kemper on this. The Health and Human Services Agency does still have a small contract with Lee Kemper. Mr. Kemper is powering down and doing less work at this point in time. He is not available to work with us on a project. However, we will phone conference with him in the near future to talk about what the direction is from the board and hear what he does have to say, but he's not willing to contract with us further to do any additional work. So again, that is my update to the Measure B committee on the direction from the Board of Supervisors from December 10th, the work I've done so far. So as I report back to the board, if this committee would like, I will report back to this committee any progress that we're making or lack of progress. But anyway, I think the operational feasibility study could actually, the overall study for all the services could be done within the next 60 days as well. And just one final comment, Chair Barish, on this. Some time ago, before the first mental health initiative, there was a study, an analysis that was done out of my office on what the services would cost. And that was at the direction of Supervisor Dan Jurdy at the time. And the question was exactly this, you know, operationally, what would the cost be of a hospital? So we do have work that's been done. It was done a few years ago. So we are looking at taking that particular analysis and revising it for the year 2020. So that does give us some information as well. And that is the end of my report, Chair Barish. Thank you.
Sorry. Thank you. Jen, please.
There you go.
Thank you.
We forget.
I know. My understanding is that early on in the meeting of this committee, there was a suggestion that something using Measure B funds remodel the old ER at the Adventist Hospital. And the county council researched this and said that it wasn't possible to provide public funds to a private institution. So I'm just wondering if that has changed or what's going on.
So, has the public had a chance to see this letter? Do you know? No. You know, I think,
It was included in the board meeting of December 10th for the Board of Supervisors, and it's included today, so it is a public document.
Right.
We could put it, so if you go to the package online, you could find the letter under 3D.
well, first let me respond to Ms. McGordy. The Ukiah Valley Medical Center former ICU was looked at as possible inpatient psych facility. When they assayed the space, they found that they could get 6 beds at a cost of $4 million for remodeling. If they wanted it bigger than that, they would have to move a wall, and they could get as much as 8 beds in addition to the other required aspects of it, which would be a day room and a kitchen, actually, even though the hospital already has a kitchen. But it would have been 8 beds at $8 million. And they decided that would not be cost effective. So that was the reason it didn't go further, because for 8 beds to spend that much money wasn't feasible. Well, there was talk of a private-public partnership, and that was another stumbling block in this. It was not deemed impossible, but just difficult. But that was another aspect of it. But because the request was for the money to come from Measure B funds, and in remodeling, and then the service fee, the service provision would be Adventist Health. So that was thrown out. I think that for the sake of understanding of what we're saying and for public comment, I should read this letter so that people in the public know what we're talking about. Dear Mendocino County Measure B committee members, we anticipate that Adventist Health will begin management of Mendocino Coast District Hospital on January 6, 2020, and a vote will take place on March 3rd that, if it passes, will set in motion a 30-year lease by Adventist Health to operate Mendocino Coast District Hospital on behalf of the district. As a critical access hospital, Mendocino Coast District Hospital is allowed to designate 10 beds specifically for mental health acute inpatient treatment. This would be very similar to the psychiatric health facility planned by the Measure B committee, but would actually allow a higher level of treatment being associated with an acute hospital. In all hospitals in Mendocino County, we have 24/7 hospitalists on site to care for our inpatients, and many times patients in a psychiatric health facility have medical needs as well as psychiatric needs. By having access to on-site inpatient medical physicians, we will be able to provide a more comprehensive level of care, keeping more of our residents in county for their medical care. Additionally, transforming an existing empty wing of a hospital into a locked psychiatric unit would be considerably less expensive than either of the sites that the committee is now considering. We propose that Measure B committee consider designating funds for remodeling the part of the existing hospital to serve this purpose, in conjunction with Adventist Health providing the psychiatric services. This strategy will require the hospital to comply to the standards of the state commission that regulates hospitals, the Office of Statewide Health Planning and Development, also known as OSHPD. In addition to adding consideration of Mendocino Coast District Hospital as an inpatient psychiatric 10-bed facility, we would also propose that the Measure B committee consider using the empty 6-bed intensive care unit in Ukiah for additional in-county psychiatric beds. Combined, the 10 on the coast and the 6 in Ukiah would total the necessary 16 beds desired to minimize expensive outmigration of psychiatric care. Thank you for your consideration. Jason Wells, President of, so he's the CEO of both Howard Hospital and Ukiah Valley Medical Center. Just to finish the question of the public-private partnership that was difficult in Ukiah, that doesn't exist on the coast since it's a district hospital. So this would be going from public to public. There would still be an issue in Ukiah, but was deemed worth consideration simply because that there would be a total of 16 beds that could be used.
Chair Barish, if I could just comment,
Yes.
since you've read the letter. I think the letter is quite clear what Jason's desire is here. The letter does not negate the direction from the board to look at operational feasibility and what the cost of those services is. This letter, and based on what Jason is saying, will actually help to get the cost of the services, because Adventist will actually submit a financial analysis of what this would cost. So that should help the information that will go to the board and obviously will come to the Measure B committee. So thank you.
Ms. Riley.
Thank you. Just a clarification. I understand the board's direction, but the description of the proposed facility at the hospitals, if I heard you correctly, CEO Angela, you indicated that it would be similar to a PUF unit, but I'm wondering if it might also fill the need as a crisis stabilization unit too. I'm just trying to put this into the same terminology that this committee has been using. So if I may, through the chair, could I ask for that clarification?
Yes.
Thank
So-
you.
Please.
Thank you, Chair Barish and Member Riley. So, you know, the direction from the Board of Supervisors is to do the operational feasibility study, and that is on the stabilization, the residential, and the PUF. What Adventist is proposing right now, to my knowledge, is just the 24-hour inpatient, which would be comparable to the PUF. Whether they come back and propose any beds that would be comparable to stabilization or residential, I don't know. But to answer your question, any and all information will be compiled together. So if they say they could do stabilization beds as well, that information will be included. And then the comparison will be what Adventist says they can do and what that cost is to an operational feasibility study that the county does. I hope I've made that clear. Does that answer your question, Shannon?
Well, I think so. I guess I'm still kind of failing to see the nexus between the board's direction and this particular proposal, but I think we'll get there. My other question is actually a follow-up to Member McGordy's question, and that's is wondering if County Council has evaluated this proposal in the context of using public money to fund remodel of a private facility. And if that analysis has not happened, I would like to request that it happen. There are some other details about the matter that I would just like clarification on. I'm not opposed to this proposal at all, but issues like the hospital not owning the hospital in Fort Bragg, they're leasing it. Can we use public funds to remodel a leased facility operated by a private foundation? So
Yeah.
these are questions that I'd like clarification on if we don't have that today at a future meeting.
And if I may, Mr. Chair, I have not analyzed that. I believe some of the reference to county council opinion may have been my predecessor. I am happy to go back, review her research, and come back to this body.
And Chair Barish, what I would ask based on Member Riley's questions is that the Measure B committee actually put these questions in writing and we submit them to the board. The board will give them, obviously, county council can begin to work on them, but the proper procedure would be that this committee, and these are good questions, by the way, but that this committee would put these questions in writing, submit them to the Board of Supervisors, and then the board would direct county council to do the research. And if I may just respond to Shannon's initial question, I understand your question about failing to see the nexus. There may not be one, but the fact is that that these items were that the letter was part of the discussion brought forward by Supervisor Williams with this item. And in order to attempt to focus what the request was so that we could actually get some information and begin to move, the decision was that Adventist would come forward with a proposal, clearly. And so, I think the last comment I want to make is that any and all proposals are on the table. I don't think there is anything off the table, whether it's the 50 people in this room that want the old Howard Hospital, whether it's the Adventist system that wants, Fort Bragg and Ukiah. There is nothing off the table right now, and there will be nothing off the table until an operational feasibility study is done. So that would be my answer, so thank you.
One further clarification. This whole notion of Adventist Health directing the Coast Hospital is relatively new, and it's been moving forward. It's hot off the presses that that this might happen sometime soon, and the notion of having a psychiatric locked ward in the Coast Hospital is also brand new, and whether we just have 10 beds without doing the 6 beds in Ukiah, or the 10 and the 6, or having a crisis stabilization unit as part of the beds, as Ms. Angelo said, nothing's been decided as far as any of those options, but it was deemed important to bring this forth to the committee in a timely fashion, because it will have some influence on other decisions we might make. I just wanted to say that. And Mr. Diamond, you had
Thank you. I want to piggyback on what a number of people have already said. My concern was remembering a previous meeting, I think as Jan did, where the question of Adventist Health, or really any other private agency or for-profit organization, being able to use public funds from Measure B for presumably program or whatever, or adding to their the benefit of a private entity. It had been brought up, as you said, Chair Barish, that it seemed to be some significant difficulties in doing that when it was brought up. So I have some of the same question of, has that been resolved? And I agree with Exec Angelo that we want everything on the table. We want to have as many options as possible, but we also want to move ahead. I think everybody, including many people that have spoken today, said we don't want to get bogged down in talking about always new potential options, but we never make a decision and move ahead with deciding on some of these things. So I guess my desire is that that the decision about whether we can use public funds within a private entity should be hopefully decided as quickly as possible, so that if we're looking now at potential options, we can look at them as quickly as possible and keep things moving towards some decisions that actually get programs in place and available for the services that we all know are needed. And we've spent 2 years so far getting to this point, and I think everybody is feeling, at least I am, I won't speak for everybody, some feeling of wanting to make good decisions, but also wanting to make decisions and move ahead and get some things done.
Here, here. Mr. Liberty.
So my recollection of the discussions with county council earlier on private-public partnerships was that they were fine. I think the concern we had as a committee was that we couldn't, if we give Adventist Health, so many millions of dollars to make a 6-bed facility, that that facility is there. It's usable, but we don't own it. We don't control it. We spend county money on something that the county doesn't own, and I think that was what was the issue. Wasn't our ability to do it. It was more our willingness to do it in a way where the county spends money and at the end of the day does not have an asset. That's my recollection. I stand to be corrected, though.
Ms. Riley.
Thank you. Yeah, I totally get the frustration. Welcome to government. I think we're all sharing that same eager to move forward. I think there could be some real operational and economical efficiencies with the hospital as a partner, so I do support moving ahead with the analysis as quickly as possible. I'd be willing to work with the project manager or additional committee members with a list of questions specifically for county council to address. If other board members would entertain that, we could have that ready. I don't know if that needs to be approved by the committee at the next meeting, but we could have it quickly.
Chair Barish, I'm sorry to talk again, but I think that in the interest of time, this committee could, actually you as chair, I think could just direct that Shannon and anybody else work with Isabel and put a list of questions together. And then Isabel can draft that for the board. We can get it to the board as soon as possible and we can move forward. To come back, the challenge is measure B the board, and so it slows down the process. So let's just get it done. I think we can do that quickly. Thank you.
Would anybody else like to be a member of that subcommittee? I would. Mr. Weir? Okay, would anybody like to propose a motion that we can just direct? Okay, so we will have a subcommittee to ask questions to the board about this partnership with Mr. Weir and Ms. Riley. And Isabel, yes, sorry. Ms. McGordy. We haven't gotten there yet because we're still, you don't have any comment yourself?
No, she's the director of nursing on the coast. I'd like to hear her.
Okay. If there are no further, there's no further member from the board, let's move to public expression, please.
My name is Lynn Finley. I'm the Chief Nursing Officer at the Mendocino Coast District Hospitals. I'm also a member of the Behavioral Health Board. And the CSU is a very important part of the behavioral health, but for the hospital's perspective, that gives us 20 hours of reimbursement for a 23-hour hold. And that's just a small piece. If we don't have an inpatient unit for that person to go to or some further treatment, it's not going to really help in the long run with our issues here. I did tour with ACE through our whole facilities, looking at all of our possible spaces, and there's a couple of different ideas of what we could do, and we even have something we could look at for outpatient services and a CRT, which would actually give us a little bit more support on the coast for our clientele. And we're really interested in working with Adventist Health and moving forward with something, because the coast desperately needs something for our clientele. So we're really 100% support of this.
Thank you, Ms. Finley. Any further comment by members of the public?
I have a question. Can I speak from here, or do I? No.
And give your name.
Please state your name.
Yes, my name is Louis Rolachek. I live in Willits. And I have a question, really. And my question is that I understand that the Adventist hospitals would provide very secure lockdown emergency treatment for people who are in such need. But there are, of course, lots of other needs for mental issues. And so if we were to be talking about this kind of a secure lockdown facility in the hospital, then are we still talking about having a facility that deals with all sorts of the lesser mental issues that need to be dealt with, and that might even go further and bring some of Emmy Good's vision as well? That's my question.
Thank
Are
you.
we talking about both things?
Thank you. Mr. Ullman.
Thank you, Chair. It's important that we understand that everything is still on the table. No one has said no to anything, other than some groups have said, no, it's not going to be here. No one has said yes to anything, and we're going through as Shannon said, we're going through the bureaucracy of that we have to go through. So to answer your question regarding, are there going to be others? Yes, because there's not one model that's going to work for Mendocino County. And so our dilemma is getting at the Mendocino model. That isn't going to please everybody, but it's hopefully going to result in the majority of the victims of mental illness at every level, so the lowest level to the highest level, getting localized treatment where they will not be taken out of county. So don't give up on this, and even if the Adventist says, we're just taking the most severe, I think that what we've seen through the development of Redwood Quality is we have seen an improvement at the lower level, but we're still focused on getting localized extreme mental health. So thank you for your comment.
Any further comment from the public?
Hi, thank you for being here and plowing through this complicated sort of thing. I'd hate to see us fritter our money away, though, when we don't get anything at the end.
Oh, could I have you state your name?
Oh, I'm sorry. I'm Melinda Clark, and I am a mental health provider in Willits. And like many of us, or most of us in town, we're full all the time, and we may not necessarily see severe crisis sort of clients. Let's talk about prevention. So we don't want people to devolve into needing those extreme services. We work every day with families and couples, de-escalating violence, teaching parenting skills, teaching self-awareness so that there are other avenues than violence to, run a family and to be on the street and work in any workplace. So I really want to emphasize also the need for preventative services. We need this, and I am experiencing myself an escalation of anxiety in this culture. We could point to the head of the government right now, but it's also the climate and it's also unstable economy, many, many factors, of course. So I hope that the breadth of this issue remains on the table. Thank you very much.
Thank you, Ms. Clark. Please.
Hi, my name is Richard Winkle. I'm from Willits. Is it in order for me to ask a question based on what Sheriff Allman just said to us, that everything is still on the table? I have some angst about reading about property that was purchased back in Willits, not in Willits, in Ukiah, that was sold to Redwood. I don't know all the names. I'm not that familiar with it, but I understand that somehow they were going to do something, and now the county has bought it back, and it is a fait accompli that whatever facility measure that the county is going to finally approve will be that property. Am I confused about I am confused about that. And it prejudices me sitting here trying to keep an open mind about hearing that everything is still on the table. Maybe you can clear up my confusion. Thank you.
Thank you. I think the next item might help to clarify.
Thank you.
Yes. And so, that being said, moving on to the next item, number 3E, discussion and possible action regarding update on status of the architect RFQ and related feasibility study, including a recommendation to the Board of Supervisors.
Good afternoon.
Just 1 second, just before you start, I just want to, I know it's your agenda item, Ms. Angelo, and Ms. Shannon Riley has a letter from Mark Myrtle, so however you want to time it, she's going to read that, but.
Yeah, I'd like to introduce the item first,
Yes.
and then I can read Mark's comment, if that's okay.
Good afternoon, Janelle Rao, Deputy CEO, members of the committee and chair. You have an item before you that describes basically the history of the item, which is regarding, again, the topic that you've all been discussing throughout the entire meeting, and that had to do with the crisis residential, crisis stabilization, and a 24-hour psychiatric health facility. Particularly, this committee made a recommendation to the Board of Supervisors to solicit proposals to develop and design and construct those 3 facilities. That was presented to the board. The board gave direction to the executive office to pursue that. The timeline describes that. There was a committee also, or a panel put together that included 5 members of this particular committee, Mr. Diamond, Donna Muschetti, Mr. Myrtle, Jan McGordy. We also had Tammy Moss Chandler, myself, and then Nash Gonzalez, who's also a consultant for the County of Mendocino. Mr. Gonzalez is a specialist in CEQA, and then we also had a consultant, Sally Riley consultant, who specializes in public project. The evaluation committee met. There were proposals that were received. We've given some status updates on that throughout the process of this. Those recommendations of that committee were presented to our board in November, along with the proposed contract. What we do have in addition, we did have a member that had requested the original proposal from Nocton Lewis. We have that available if your committee would like that, and we also would make one available to the public that would lend some substance to where we started versus where the evaluation committee came forward with the recommendation and the contract that was presented to the board, which is also here for your information as well. That recommendation was made on the 19th. The Board of Supervisors took an action to approve that contingent upon the recommendation for use of the funds coming from the Measure B Oversight Committee. And that's what is before you today.
Thank you. Any questions of Ms. Rao?
So I wanted to add to this because I think there's some important details we need to also discuss. This did go in front of our Board of Supervisors with a contingency that the Measure B review it and approve it. One of the things we've talked about a couple times is that we do have a CHAFA grant of $500,000 to build a crisis residential treatment facility within Mendocino County. One of the requirements put on Mendocino County by CHAFA was to come back with an approved contract from our Board of Supervisors to their December 5th meeting. We were not able to do that because the contract was contingent and hadn't been approved by Measure B. In attending that meeting, we were at a point where they were wanting Mendocino County, or they were going to forfeit our funds of $500,000. We were able to negotiate with them to give us some additional time so that we could come back to Measure B and back to the Board of Supervisors to get support for this project. In that, they did put some contingencies on us. One of the contingencies is that we build a crisis residential treatment on the Orchard Street property, which was the property originally purchased to build the crisis residential treatment center when we were contracting with Redwood Community Services to do it. The reason they're saying Orchard Street was because that was the original intention of where the crisis residential treatment facility was supposed to go, and it was originally in our agreement with them to do that. So they are going back to the fact that this was the property purchased with county funds, and it was purchased with county funds, and was supposed to be reimbursed by the grant. And because that's what we've agreed to all along. The second requirement is that the Measure B committee approve the contract with Nocton Lewis so that we can move forward with that. If I go back January 30th to the CHAFA board and we have not met their requirements, they will forfeit the funds from Mendocino County and we will lose $500,000.
Thank you. Mr. Diamond, did you have another comment?
Yes. They're tied together. You mentioned that a number of people from this committee were in the meeting that evaluated the various options and the different architectural firms. I was one of the members. And I had some questions. If you read this, I think anybody who reads it, it's very complex and it's not in my area of expertise, so I'm relying on those that are more knowledgeable than I, but we're being asked to vote on it. And so I had some questions that I submitted in writing that got answered and are part of the packet. And I just want to let you know where they are and tell you briefly what my questions were. And answers came, I think, from Janine and a number of other people to answer the question. So let me just briefly say what my concerns were. I said there have been questions about whether we can attract and keep qualified professionals who would staff the three facilities for which we would be recommending funding. And I asked who would be the most qualified to help us understand whether we can attract people, because we don't want to build it and we can't get staff, and that's been brought up a number of times. And second question was, excuse me. Second question, I said Nocton Lewis has submitted a detailed plan for their services with a specific budget, and how much additional money will be needed to actually build the 3 units, because the fairly sizable budget, has to do with a lot of other things, but it's not the total cost of actually building the facilities. And I asked, what's it going to cost? We're all talking about cost, but I didn't have a sense from what I could read in Nocton Lewis that I had an idea of what the whole cost was going to be. And now we're looking at other alternatives. I need to be able to compare. So that was question number 2. Question number 3 was total cost. What's it going to cost for all the things? Number 4, how do these estimates compare with those detailed in the Kemper Report? And number 5, who is the person most qualified to say how certain these estimates are going to reflect the actual cost? And I know we can't do this 100%, but these questions were answered. I won't go into the answers. They're in the packet, but you may have trouble finding it in all the other things. So if this is of interest to anybody on the board here or the community, you'll notice it's in, where are we with the agenda? At the bottom, it says under 5A, communications received. That's where it is. If you hit, is there a tab for that? I'm just looking. The very back. Okay. Yeah, I got it. So if you want to find that, look there for the answers to the questions. And one of the things I just alert you to was I had asked, I think you answered this one, Janina, or somebody did, that the different facilities have different levels of assuredness that we can get staff. And you or whoever answered the question said that some of them, hey, these we know we can get staff for. These are, they're not assured, that there would be some challenges to getting staff. So I think those things need to be addressed in addition to the facilities, where they are and how much it costs. So thanks.
Ms. Riley.
Thank you. I'm gonna, Member Myrtle could not be here today, and he was a member of the review committee, so I'm gonna put on my electrician hat and read a statement from Mark Myrtle. So, He says, I'm sorry I could not attend this Measure B meeting. I'm attending my son's basic military training graduation in Texas. The selection of the architect/design team for a feasibility study, design preparation, and construction drawing and construction implementation of a CRT or CRTS, CSU, and PHF has been a detailed, objective, and finally negotiated project. Many hours were spent reviewing and evaluating proposals of 4 applicants. Many hours were spent interviewing and evaluating 2 prospective designers and the related teams. Finally, days were spent revising contracts, scopes of work, and most importantly, pricing to arrive at the $3.3 million, which was presented and approved by the board. As you can understand, $3.3 million is a lot of money for our citizens to digest and understand. However, it is what is absolutely required and demanded as noted in the Kemper Report and in the Measure B language. Our mental health patients need a place to go in time of crisis and post-crisis. We need to move forward with approval of this money so that we can get these needed facilities in the process of being built and not just acronyms that we talk about at each meeting. Please know that I have spent a great deal of time and mental effort evaluating this selected proposal and think it is fair for the work and partnership that is being asked of our recommended design team. Please move this process forward and approve the budget to contract with Nocton Lewis. Thank you.
Thank you. Sheriff Allman.
This is probably the number one emotionally angry conversation that I hear from citizens regarding, we have nothing, but you're asking to spend $3.3 million. So let me tell you my perspective. And I tell you my perspective out of current experience that Nocton Lewis is a very professional firm in Sacramento. We, as in Mendocino County, have hired them. We hired them 2 years ago to start the work with the sheriff's office regarding the mental health criminal wing that's in the process that we have a grant for to build at the correctional facility on Low Gap Road. So when I hear people talk about the 3.3 million, I often have to correct them out of politeness to say it's an up to 3.3, because what we've learned at the jail with our contract with them, it's an a la carte type of contract. And let's say that we as a group, let's say hypothetically we pass a 3.3 contract today. And then we also say, we don't want, and I'm just saying this hypothetically, so I'm just gonna pick a number, we don't want crisis residential. Well, we're not going to pay Nocton Lewis to do the research on crisis residential. They're gonna follow what we are recommending. And so this is a cart and horse situation where we have to get to the point of paying somebody to do the governmental and bureaucracy requirement to get this necessary step done. So to the public, $3.3 million is a lot of money. I get it, I understand. But that's not what this contract's for. This is for up to 3.3. And now that we have a project manager, I'm very comfortable in listening to what Mark Myrtle had to say. And Mark Myrtle's a contractor that does a lot of government work. And I wish he could be here today, but I certainly congratulate him and understand why he can't be here. But he is probably the most knowledgeable private person on this committee that deals with government contracts. And he has said yes, and they put a great deal of research in it. And so this isn't 3.3 million that's being spent and forgotten about. We're at the fork in the road. We're at the point of saying, we passed the initiative, we have our committee, we have monies coming in, now we have to make a decision. And the decision that we make has to be based on current government building standards, and this is an architect, it has to be built on current needs, and we have the Kemper Report. We have to make a step forward. And so I'm certainly prepared to support the up to 3.3 million, because that's where we have to go unless we want to continue to meet and talk about and ask ourselves where we need to go. Thank you.
Ms. Riley?
Thank you. So I have some questions about the nexus on this item as well. We have a proposal before us for architectural and pre-development services, and then at the same time, we're being told there's a CHAFA grant of $500,000 that has some very specific requirements, which are part of the scope of work that we're asking this contractor to do. We're eliminating part of the scope of work. So I have questions about the contract itself, but first I'd like some clarification about the CHAFA grant and how long we've had this, why this is just a Measure B issue now, and how it fits into the context of this agenda item.
So we applied for the grant, and we've had it about 4 years, and we applied for it and were awarded the $500,000. The original proposal was in 2015 when we were awarded the dollars, and at that point, the original agreement that went to CHAFA was with Ortner Management Group. As you know, Ortner Management Group pulled out of Mendocino County, and so we had to go back to CHAFA, find a new project partner that was willing to work with the county to build the facility, and that took some time. We then went back in front of CHAFA and had Redwood Community Services, who were willing to work with us and move forward with our CRT. At that time, there were some grant dollars that were applied for through with Redwood, and the funding didn't come through. So and then Measure B went through, and as Measure B's been talking about a CRT, that's sort of where we've kind of ended up here with it being here for the $500,000. So we've had to go back to CHAFA a couple of times and ask to amend it because the original was with Ortner, then it was with Redwood Community Services. Those fundings did not go through. We had the 500, but not the additional funding. And so with Measure B, that was where we started talking about the CRT. We had a choice to say, let the 500,000 go, or see if this was grant funds that Measure B wanted to use to build the facilities we were already talking about.
May I ask a follow-up question?
Please.
Thank you. Okay, so it sounds like, though, when the committee was reviewing these proposals and creating this, that the CHAFA grant was not a consideration. Is that accurate?
That is not accurate. The CHAFA grant was always a part of the consideration. It was actually, CHAFA has a time frame that we have to meet. They've been, originally it was like June 2021. They pushed out to October 2021, and then they recently said they'd give us till December 2021. So they actually have a deadline that we have to meet to be open and operational. One of the things when in this negotiation and looking was what could we do to meet the deadline to have a facility and have the architecture that we were working with meet the deadline of CHAFA. So that has always been a part of the whole process of having that conversation.
Okay, thank you. And then I appreciate the sheriff's clarification that this is an up to $3.3 million contract. It does seem like with the conditions of the CHAFA grant, along with the proposal from the hospital, there's a significant amount of the scope of this contract that could actually be eliminated. And so I want to understand how flexible this contract is within the scope of the RFP that we put out there. If we eliminate half of this scope of work, are we still in compliance with county purchasing processes? Are we exposed in any way?
If I may, through the chair. We've been considering various phased-in approaches, and particularly due to the CHAFA timelines and constraints, and that was a great deal of the work that went into the development of the proposed scope of work, in that we could meet the timelines by a phased-in approach. The first phase of this truly actually focuses on the CRT, even though it was written in general terms. The timelines and the information that actually came in from the architect in somewhat of an out-of-the-box thinking approach in order for us to meet these timelines was to address that in a phased-in manner. You could look at this in a couple different ways. You can look at the phased-in approach that's currently within the scope. We could entertain a revised scope of work, which I've actually discussed with the architect just in conceptual thinking. as it's written, and if this committee gives direction or a recommendation back to our board, we would take that to our board with the same options for them to consider. In that, you may want to consider phase one only under contract. Phase one only in a rewritten scope could be the CRT alone with focus on Orchard. So there are many options. We can continue with this current contract as written, still be in compliance with our current competitive process, and still work with the project manager, the architect, and the team that you see here with Janine. And we have many, Tammy Moss Chandler, she has a consultant also that works in this, that would be working to address this and ensuring that we're within the scope, but also not exceeding any area that isn't necessary.
Okay, thank you for that clarification. The staff report that went to the Board of Supervisors indicated that, or proposed the remodel of 3 residential homes for the CRT, but what I'm hearing today is that the CHAFA grant is requiring that the CRT is on Orchard.
It's conditioned. It's conditioned. They have conditions, and just for everybody's knowledge, actually, Nocton Lewis did attend that meeting with Janine Miller on their own recognizances. To be able to support the county as a team, even though they're not under contract. They've guaranteed that whatever it is that we're doing, they will assist us. They're here as a team. If it requires a revised scope, we'll revise the scope. But they assure us, even in whatever condition this contract is written, it's not written in a way that we're restricted. It's written in a way, and the up to is a very important, and I appreciate the sheriff's comments on that, because the up to amount is what's critical. This was to get us from point A to point B, but in between there's a lot of fluid because of the uncertainty under feasibility. So with this, we can, during feasibility, focus on Orchard, if that's the recommendation and direction of our board once we go back to them.
Ms. Angelo,
I don't want to cut off Shannon. I don't know if you had any other questions.
go ahead, go ahead.
Do you mind? Sorry, thank you. And then I'll defer to the rest of the board. So I do support that this work needs to be done. I appreciate the clarification regarding the flexibility of the scope of the work, as well as the clarification that this is an up to. I also respect Member Myrtle's expertise, as the sheriff said, in the construction industry, particularly with public projects. I do have one concern about the project, the way it's proposed. I think it's imperative that local jurisdictions have some say in the projects that may be placed in their jurisdictions. And this is something that has come up through countless audience comments from the city of Willits. The city of Fort Bragg has expressed a concern. This is not about saying not in my backyard. It's not saying, for example, that Ukiah would not support a facility on Orchard. But it is important that the city of Ukiah be included in the entitlement process, the way the documents are written. And truly the requirement is that they be reviewed by the state architect, state fire marshal, and county officials, excluding the local jurisdictions. And I think it's important, if we want support for these facilities, we've heard about impacts to parking, light pollution, all kinds of things. If we want the communities to support these projects, it's important that they have a say in shaping how they will be placed in their jurisdictions. And so I'd like to hear from the rest of the board, but I'm inclined to support this contingent upon the addition of the inclusion of the local entitlement processes. Thank you.
Ms. Angelo.
I would like to clarify for those people in the room and those people listening who are not that familiar with this proposed contract, that this is looking at Orchard Street, and it has always been looking at the old Howard Hospital. So for those of you in the room that are interested in the old Howard Hospital being a part of the mental health continuum, this particular proposal does include that. It also includes, and again, the sheriff has confirmed, it is up to. So we have Orchard, we have the old Howard Hospital, and we also wrote in there any other location. And so the reason for that is, you know, I don't know if anybody else remembers this, but I've had multiple discussions with people from Willits who have said absolutely not. that you do not want a psychiatric facility at the old Howard Hospital. And then knowing that the possibility of having a facility in Ukiah could create an issue as well. And when you have two government entities that are going back and forth, we know that there can be a delay. So with that, we put in the RFP that there would be an additional location if needed, so that we would find a location in the unincorporated area if we found that the city of Willits was adamantly opposed to Howard Hospital, if we found that the city of Ukiah, and I'm not saying that Ukiah is, but if we found that that was the case with Orchard, and we know we have an issue with the Chaffa grant now, that we could look for a location in the unincorporated area. So I just want to assure the people in this room that Howard Hospital was a part and continues to be as of today, even though I know Howard Hospital is up for sale, so we don't know what will happen there. But both of those locations and a third in the unincorporated area have been included in this. Thank you.
Thank you. Mr. Liberty.
Thank you, Chair. Looking back at item 3D, it looks like the board is asking us to, or asking, actually directing staff to look at the feasibility of operating a PUF unit, for example, the feasibility of running one of these facilities. It seems a little inconsistent to say, well, let's do a study to determine if we can run them and if we can operate them while we're designing them and spending $3.3 million potentially to design them. It seems like we gotta, if we're gonna do one, we need to wait for the outcome of that before we do the other, it would seem. And then the other thing I'd worry about I'm concerned about is, so a rule of thumb, and Mark Myrtle would be great to have here to discuss this, but a rule of thumb is the architect's bill is around 10% of the total project price. So I don't know how much of this proposal is the architectural work, but just for example, if it was the $3.3 million, that means we're talking a $33 million facility, and we don't have that kind of money. And especially when you put it in the context of the firm that Margie Handley hired to evaluate Howard Hospital, they were thinking 18 million, assuming prevailing wage. So we're looking at potentially as much as 33 million. If you went all the way to 3.3 million for architectural work, that would sort of indicate 33 million for the building to get it built. And then the other side is the board is looking at, the Board of Soups, who's got the purse strings ultimately, is looking at, can we afford one of these once we have it? We really need to put all that together before we make a decision here. Thank you.
Sheriff Ullman.
And thank you, Ross, for that. I don't think the intention of the architectural contract is to immediately get started on everything as soon as possible. That's not it at all. The purpose is to get started through the project manager of where we're going. And this board, as we meet once a month, would be updated to where the progress is on what. Let's use your Howard Hospital 18 million, for example. If that was the case, I think one of the first things we would ask Naughton Lewis, stay away from the psychiatric health facility and work on the crisis residential. And let's get going on that. But the Board of Supervisors, I was surprised they passed this, because they watch Measure B very closely, and Supervisor McCowan has clearly said he won't do anything without Measure B's approval. But this was an exception to that. And so now they did this, and they're asking us to approve what they've done, which was a timely manner needed to be done. But I think that you're a reasonable man, and you're a private businessman, and I appreciate you. However, this isn't an all-extreme situation where we are going to ask Naughton Lewis to spend as much of it as possible. We're going to get started as what we need. And if we have this Orchard Street, and some work has already been done on Orchard Street. Matter of fact, that some of the renderings were given to us at one of our meetings last year. And so there's obviously already some kind of design of where we're going on it, and that on its face is gonna save us money too. So it's not worst case scenario spending that kind of money and running out of money. But let me say this, if we're saying that the architect is 10%, that's what we're doing with the jail building, okay? Measure B is going to provide around $35 million for brick and mortar. And so now, this is a $3.3 million up to bid. I think we're right in line there. Thank you.
Ms. McGordy, did you have another comment?
Thank you. Yes, I would like to speak about the CHAFA component since I was at that meeting. So if you remember in the Kemper Report, those of you who studied it, that was the first recommendation in his report that we build the CRT on Orchard Avenue. This is a crisis respite treatment center. The one that was originally proposed there included a CSU, a crisis stabilization unit. From what I've learned in this long process, we visited a crisis stabilization unit in Grass Valley. They're most effective when located on hospital grounds because they don't take all patients and they need the collaboration of medical professionals at a hospital. So we're talking about multiple buildings and multiple sites. The CHAFA people were really upset that our county appeared not to have done any action after 4 years. And that's why this was a condition to get the money. We don't have to take the money. We don't have to have it on Orchard Street, but that's their condition. So, you know, we don't have to take the $500,000. We can let it go and look at other options, but it's also not the only building that we're looking at. There could be other crisis residential treatment places in the county in a residential area, for example, something that was being considered. So I'm hoping that this board will go ahead and confirm the contract so that we don't lose $500,000 in the county, because that's a lot of money for us, but that's kind of what's on the table. Thank you.
Any further comments from the board? So my understanding is this requires an action. Oh, I'm sorry. Yes, go right ahead. Go ahead.
I just want to say to CEO Angelo regarding delays in the process as a result of local input, and I appreciate that concern, and I can say that the city of Ukiah, and I can't speak for Willits and Fort Bragg, but I think the jurisdictions would work to expedite and be as cooperative as possible. I'd like to cite the Willow Terrace housing project that was recently done by RCHDC in Ukiah on Goby Street as a really successful project. This is 37 units of housing for mentally ill, homeless, or at risk of homeless individuals. These are, they have some severe supportive needs, and because RCHDC worked early and often with the city of Ukiah, we were able to streamline their project, and it has been integrated into the community very successfully. They had neighborhood meetings, they met design requirements, and they still met all of their funding requirements. So it can be done. I don't think it needs to be overly onerous, but it's about getting the support from the communities that these facilities are placed in. Thank you.
So, do we have a motion? We are in great danger of far exceeding our time allotment for this meeting, so I'm going to have to limit public exposure to 10 minutes for each topic. Ms. Hanley, did you want to?
Mr. Chair, before you go there, if I could just clarify a couple of procedural points.
Please.
So the action of the Board of Supervisors had been to approve the contract contingent upon an affirmative recommendation from this body. If there is a motion for recommendation at the conclusion of this item, then the contract will go ahead and get executed and be valid as of that point. If there is any other recommendation, the matter is simply going to be referred back to the board, which may or may not result in needing to start a new competitive process. In terms of this mention that was made in terms of local approvals, I would just mention I would be a little bit hesitant to try and amend the contract to address approvals that may or may not be required. If there are any required approvals, I think that the scope of work is already going to be sufficient to allow that to be encompassed with what is in the agreement. But since there's no site, there's not clear whether this is going to be in a city. It's not clear whether this is going to be public or private ownership at this point. I think there's too many unknowns to put in something that may require something that ultimately turns out to be unnecessary. But I do think the contract would be sufficient to allow those services to be performed. And then just to speak briefly to the sheriff's point, I do want to confirm the billing is actually at an hourly rate under the contract. The figure that's been quoted is a maximum dollar figure, and it's actually broken up in the payment terms, if you'll see, by the particular phase. So each particular phase, and phase 1 is pre-design services, which I believe needs to be completed before they move on to any actual architectural design work. But each phase has a separate cap, which will be billed at an hourly rate, and then is not to be exceeded under the terms of the contract. Thank you.
Okay, I'm Margie Handley from the Howard Foundation. I just want to correct Ross's number for the record. We received a quote from a design build contractor. The architectural services were paid for $48,000 by the foundation. The low price was $11 million. Sorry. And if you'd use prevailing wage, it would be $14 million, and it was ready to. All the architectural work was done, and I'm sure if you ever decided to do it again, you'd have to update that number. But that was a firm quote.
I was just anticipating the new
well, 18 million is different than 14.
Yeah. A million here, a million there.
Any further public comment?
I want to thank Sheriff Allman.
State your name, please.
My name is William Barksdale. I want to thank Sheriff Allman for the clarification of $3.3 million. The Orchard Avenue property is not owned by the County of Mendocino, and I'm unclear about exactly how that's going to work. It's owned by Redwood Community Services Incorporated. Well, this is as of October 2019. This is a public record that I have. And the site that is undeveloped is about approximately 200 feet by 163 feet. That's the size of about 2.5 Brook Trails lots. And that would have to include parking and everything. I measured it. I was there on site with people in this room with a tape measure. I measured it. It's about 200 feet by 163 feet. The total for the first 5 years of income from this tax is approximately, according to the Kemper Report, $37.5 million. That includes not just facility construction, but also treatment. So, and there's been very little treatment, and I don't want people to lose sight of the fact that Measure B is meant to be not a total contained program in itself, but a support for current mental health treatment in the County of Mendocino. And I've worked with many of those people because I've helped a number of people get help through that system. And those workers are stressed, very stressed, and they need help now. They don't need help 5 years from now. They need help now. So the sooner this can happen, the more, that's crucial. It's crucial that this help happen now. So sorry for the emotion, but I feel like things are slipping through the cracks here, and I don't want to see it slip through the cracks. I want these county workers to get help, and most of all, I want the people who need the help to get the help. It's them. It's their families. goes out, it trickles out to many different people. Thank you.
Thank you. Any further? This will be the last comment.
I'd like to direct my question to Ms. Onley. Can you tell me, Nika Huffman, can you tell me, does that include the loss of homeowners' properties? Does that include fixing the street that runs back behind the hospital and doing so much work on it to getting it to up to par for the mental disabled? Are you going to put sidewalks in and curbs and gutters, which is required, which would go up and down?
Okay.
You
need, please address the board, please.
Oh, I'm sorry. Anyway, does that include the street work? And what I was told with that a 10-foot fence was going to go up. Is that so? I mean, lead me up to par, because I don't know what all is going to go up there. And I think the homeowners should be involved in some of this, seeing as how a lot of their homes are, is their retirements and places where they're going to retire. I put 33 years in a sawmill. I paid for my home. I worked hard, and I didn't sit at a desk to do it. Now I'm worried about my property. And I'd like to know, when you guys start doing all of this, I'd like to know ahead of time what's going to go on.
Thank you.
Thank you, sir.
So, I believe, yes, Sheriff Allman.
Well, I'm ready to make a motion if there's no more comments up here.
Please.
So to the clerk, can you read the motion?
I would need clarification on the motion. We haven't had one on the floor yet.
I'll make a motion of the recommended action. Recommended action is approve agreement with Knox & Lewis for pre-design, design and construction support services for crisis residential treatment, crisis stabilization unit and psychiatric health facilities in the amount of $3,357,568. I would like to say up to that amount is the change of this to council. Effective when agreement becomes fully executed through June 30th, 2022. Authorize the purchasing agent to act as project manager and approve change orders for the project pursuant to Public Contract Code Section 20142 and sign any amendments that do not exceed the maximum agreeable amount.
Is there a second? Ms. McGordy, all in favor, please say aye.
Aye.
Any opposed? The motion passes. Moving on to agenda item 3F. Discussion and possible action regarding report from the Regional Behavioral Health Training Center Ad Hoc Committee.
Thank you very much. Dr. Miller and I have had a chance to walk through the building, and let me give you the update. So for the public's edification, the training center has been purchased, and some work is underway. The work is very minor. The theater seats have been removed and stored. The carpet has been completely cleared out because it had over 500 holes in it from the theater chairs. The floors have been patched. Some of the walls have been painted, and the carpet has gone out for the work for the carpet has gone out for the request for proposal, the RFP. This board, as you remember, in October authorized up to $50,000 for expenditures to get us to where we are right now. And with the carpet and with the tables and chairs that have been ordered, and the hopes that the training center is going to be in operation by the end of January, maybe the first part of February, when it was authorized at $50,000 to go to the capital improvement project, the CIP for the county, I originally had asked for $250,000, and it was $50,000 so we can get started, and now we're started. The county building and grounds people have started the work of developing the necessary work. There's been no walls that are moved, but there's plumbing that needs to be taken care of and so forth. And as we said from the very beginning, this building was, it cost this group $271,000, and with the expectation that some money was going to be put into it for upgrades so we can use it for a genuine training facility. So some of the things that we're looking for is to, there's going to be a commercial kitchen in there because it's going to be a meeting facility. We have to improve some of the security, do some slight improvements on the parking in the entrance, and then signage. And so that's where we are right now. I expect the $50,000 to be consumed at the end of the carpet RFP and some of the paint cost. And I would appreciate today if we could move ahead with approving the $200,000 so we can continue, so we can use the training center as its intended use. Thank you.
Mr. Liberty.
Okay, Tom, so keeping your feet to the fire, are we still within our $500,000 budget all in?
Absolutely.
All right, you got my vote, buddy.
Ms. McGordy.
Yes, originally we had asked for a plan. So, I mean, a plan on a piece of paper is kind of what I thought a plan would look like. So I'm kind of thinking that's what we would need before we commit more money.
And the plan that I've asked for from planning or from building and grounds isn't completely received yet. We can wait until January for this and it'll be on the agenda anyway as a fixed item. And the only thing I would say to that is that we'll continue to delay the training center. We're not overexpending any dollars, but the doctor and I have talked about what's going in there and the electronics and the improved Wi-Fi and the improved sound system and so forth is what the plan is. So for those of us who attended the tour, they have a general idea of what the walls are, and no walls are going to be moved. And so the plan specific is a layout that was received by the church when we purchased it, that we have from the realtor. Thank you.
Mr. Diamond.
There's a lot that we have on our agenda today, tomorrow, and the next days, and all our meetings. And many of the things are going to just take time. There's just no way around spending a lot of money in building facilities or redoing that doesn't take time. The training program is something that can happen now, and something that in the area of prevention, which I believe in, and I think most of us do, is something we can get started right away. And we've already got the training facility. So I'd like to make a motion that we approve the budget as outlined. I trust the sheriffs and the planning that's coming that will be there, and I would prefer not to delay another month until we get started. So I'd like to make a motion that we approve the funds as requested.
Is there a second?
Okay, Ross, you do it.
Any further discussion?
Yeah, I would support this, and also, it would be also a recommendation to the board that they approve it.
I'm sorry, yes.
Yeah, okay.
Mr. Rear, it would be that, yes.
Thank you.
Any further comments from the board?
Chair Barish, just one comment is that this actually has been one of the easiest county processes with purchasing this property being in as good a shape as it was, the cost of this property, and moving forward. I want to actually commend the sheriff, who has worked really hard to get this property to where it is today. So I fully support this. Thank you.
There's a motion on the floor. All in favor?
Mr. Chair, I would suggest public comment first.
Oh, thank you. Thanks for reminding me. Would there be any public comment?
Joe Bradley, Little River. I would really ask that all of you pass this. The training is, like was just said, needs to be done. One of the ladies earlier said she's seen problems with people that are first responders that have no training, and I personally have dealt with that myself. So I would really love to see this training facility go forward.
Thank you.
So please approve the 200.
Any further public comment? So with attention to the motion on the floor, all in favor, please say aye.
Aye.
All opposed? The motion passes. Moving on to the next agenda item, 3G, discussion and possible action regarding report from the Kemper Report Ad Hoc Committee. Ms. McGordy.
Thank you. So at our previous meeting, we had recommended that there be a 15% prudent reserve set aside with all the funds. And we had been asked to go back and develop a policy. We haven't had a chance to have that meeting yet. I think it was to figure out when we would start the 15% or if there would be a 15%. I just wanted to make note to the public that we haven't been allowed to talk about services to be provided, which is interesting now that there's all this interest in what services are needed at the facilities. So I apologize, and hopefully at the next meeting, there will be a policy to submit unless you're interested in a 15% reserve flat now.
Thank you, Ms. McGordy. Any comments from the board? Is there any public comment? Okay, moving on to item 3H, discussion and possible action regarding development of Measure B budget. Ms. Riley.
Thank you. I requested this item because I think it's important for our committee to understand the budgeting process. We started this venture kind of mid-year. In December of 2018, we approved the 18-19 budget, so kind of halfway into the year. But at no time did this committee specifically discuss the 19-20 budget. We did not discuss it, we did not adopt it, and yet there is a Measure B budget adopted as part of the county's overall budget. So my question for the group or for county staff is for who created the budget, how did that happen, and how can we expect to be involved in the process in upcoming years?
Yeah, I can speak to that. As you know, this is a year-round process to prepare the budget and monitor the budget throughout the year on a quarterly review basis. So there are deadlines for submitting the figures from the departments. We normally would have probably relied on our project manager to initially prepare a budget for a one-year period. Since the committee did not have one, we were running up against the deadline to submit a budget to the board so that it would be included in next year's packet. So the CEO and the auditors committee, budget committee, quickly put together an estimate of what we thought the plans would entail during the next 12 months. And short of not having a project manager to help us build the budget, we went ahead and put in those estimates so that business wouldn't come to a halt. In other words, in the county's budget process, we have to have an approved appropriation in place in order to make an expenditure. So once the board approves their expenditures for Measure B, again, if that appropriation is not in place, it does not move forward unless we submit budgets each and every time we go to the board with an expenditure. So this was an attempt to get something in place that is an estimate so that when the board actually approved their expenditures, we would be allowed to spend our Measure B funds on what they were intended for. So it was not an intention to circumvent the committee. And now that we have a project manager, I believe this responsibility would start with that process, put together a budget, maybe have an ad hoc or something to that effect to review it. But that was the history on how it got in there for now.
Thank you for that explanation. So I would like to to ensure that our project manager and probably the auditor, and I know this other committee has been working on creating a budgetary reserve. I think we need some people who are going to be tracking this so that we don't miss the opportunity to be involved in our own budget next year. So I don't know if it's appropriate to ask the auditor to work with the project manager on the timeline for that, what that would look like, but that's what makes sense in my head.
Yeah, and we're currently waiting for the board to pass their calendar for next year's budget process. So as soon as we get that out, I think we can get together with the project manager and come up with a schedule for a budget.
Thank you.
Thank you.
So can that be an agenda item specifically for next month's agenda? Thank you.
Any further comment from the board? I invite public comment on this item. We'll move on to the next agenda item, discussion and possible action regarding reorganization of the Measure B committee structure. Mr. Diamond.
Yeah, this is mine, and I know we've been here a long 2 hours, and we're getting to the end of the meeting. Thank you all for hanging in there, all of us here and in the audience. So I'll read my recommendation and rationale for this item so we can move through it hopefully quickly. I said when we were first formed, the chairman, Tom Amman, warned that there were two ways the committee could become ineffective. The first was that we might make decisions too quickly and waste time and money. The second was that we would have endless discussions and make decisions too slowly, and people would lose confidence in our ability to take effective action. It's been challenging not to go too far one way or the other, but I feel our structure has contributed to our leaning toward the second problem of too much discussion and not enough constructive action. To remedy this problem, I suggest the following changes. It may require a revision of our bylaws, at least CEO Angelo said this might be, I don't know. So number one, I'm recommending that the chair and vice chair will serve a 2-year term rather than 1 year. My rationale is that we only meet for 24 hours a year, and the leadership by the chair and vice chair would benefit if he or she could continue for 2 years instead of 1, I believe. Number two, that we create a 3-person executive committee made up of the chair, the vice chair, and the program manager. The executive committee would be charged with developing a plan for the full year's work by the committee so that we can look ahead and see really what we're trying to get done in the year, create an agenda for each meeting with suggested input from other members of the Measure B committee, and appoint ad hoc committees as necessary to ensure the committee makes sound recommendations as expeditiously as possible. Now, my rationale is this, that presently there's no overall plan of what needs to be done and what needs to be accomplished through the whole year. So in my mind, it's hard for us to predict where we need to go in the next meeting or the next number of meetings. It's difficult for the community to know where we are in the planning process or the decision-making process. And since every member can place an agenda item on the agenda, we have a tendency to bounce from one thing to another, that we start here and somebody presents another agenda item and then we go over there rather than being able to stay on track. So third, I believe that the chair and the vice chair should be chosen from the citizen members of the committee. As you know, there's some citizen member, I call them citizen members, that represent the various aspects of the community, and there's members who are part of the county government structure. So I'm suggesting that the chair and the vice chair, in other words, the leadership of the committee along with the manager, be chosen by the committee citizen members, which are these that are in the law. 5 members appointed by each of the county board of supervisors. So there's 5 of us. I'm the representatives from the 3rd district. Member representing the Behavioral Health Advisory Board. In this case, it's Jan is the member now. and the member representing the Mendocino chapter of the National Alliance on Mental Illness. And I believe Donna, who isn't here, represents that. And my rationale on this is that since Measure B was passed by the voters, the community representatives are the most connected to the voters and should be responsible for the leadership of the committee. And at least we all are in the community, we all get input, but I think it would benefit if the leadership of the committee came from the community members. So that's my recommendation, and I'm interested and hope within the time frame we have can get any feedback, and hopefully we can get a vote on this if it looks like it's something we want to address and take action on today.
Did you have a comment?
Thank you, Chair. To the 2-year term for the chair and vice chair, I think is a wonderful idea. I mean, there's talent and experience when you become the chair, and I think that's a wonderful addition to our bylaws, and I think we would have to change our bylaws. 3-person executive committee, I mean, that would just be an ad hoc, and I think that's the right way to do it. As far as the third recommendation, I would not support it. I believe that while there are government employees who are on this committee, such as myself and such as Dr. Miller and the CEO, we certainly have a perspective from our leadership roles in the county of the mental health needs. And so, and I'll use Member Riley, for example. She would be classified as a citizen member according to this, but she's the deputy city manager for the city of Ukiah. So she's a government worker, but it would, I don't see as any one group having more accessibility and knowledge about mental health than any other group. And so I personally would support the first and second, but the third, I think eliminates the ability for us to have leadership circle or rotate around and have perspectives from all parts of our society. Thank you.
If I may offer one point of clarification, on the ad hoc issue, if any member of the committee is not, if any member of the executive committee is not a member of this body, then it can't be treated as an ad hoc. It has to be a Brown Act compliant body. So if you were to include the program manager as a formal member of the executive committee, that would become it would have to be Brown Act compliant. If you wanted it to be an ad hoc, you could simply appoint a few members, whether that's mayor, vice chair, and vice chair, to work with the program manager or other appropriate staff.
Thank you. Ms. Ryan.
Thank you. I appreciate Member Diamond's efforts to streamline our activities, and again, I think we all want that, but I also have tremendous faith in our new project manager. I was part of the interview committee, and much like our budget process kind of got astray because we lacked having some staff dedicated to paying attention to our cadence and our responsibilities, I think this is a lot of what we're looking for in this recommendation can be provided from the project manager in collaboration with the chair. So my recommendation would be to kind of put a pin in this and let Isabel get trained and see where we can head from there. But I think we've made a lot of progress, as frustrating as it might seem today. And I think we've got the dedicated staff on board now with leadership from the CEO's office, and I'm optimistic about that.
Thank you. Mrs. McGordy, did you have another comment?
Thank you. So I just wanted to say I don't believe we have a set of bylaws. We have something else that we operate under. And I know that Donna Moschetti is coming on board as chair, and she's quite accomplished at chairing meetings, and I think she'd be, really valuable in helping direct things. So I don't think it's the time to change things at the end of a year, but perhaps to be looked at the beginning of the next one. Thank you.
Ms. Angelo.
Thank you, Chair Barish. I support Member Diamond's item. I think that actually having a chair and a vice chair for 2 years is a good process, because I think probably the sheriff could even speak to 12 months, can really be a very short period of time. So I would support the 2-year term. I also think having an executive committee developing a plan for the year is also something that might benefit the committee. We do meet, and Member Diamond, you have not been an officer yet, and so you're not aware of that, but we go ahead and we meet with the chair every month, and we go, and Ace can speak to this, we go over the agenda items. So we treat this meeting and this committee just as we do the Board of Supervisors, because this committee adopted the rules of procedure, which are the board rules of procedure, and so they are our bylaws. So, but again, number one and number two, I fully support with the addition that County Council brought up, that the project manager would be staff to the executive committee. And I also think that regarding the citizen members, I fully support that as well, because if this is a citizens advisory committee, then one would think it would be citizens who would be officers. However, just based on the fact that there is not full agreement among this committee, that it might be a policy decision that the board would make, or it may be a legal question as far as citizens advisory committees and what they're comprised of, and what the membership and also the officers are. So it may be that number 3 is something that we need to look at. But I think that you've done a good job as far as really thinking about the last 2 years of this committee, how we've moved forward, how we haven't moved forward, and how we could make it better. And I also think that our new chair coming on, along Chair Barish, we've had Chair Allman and then Chair Moschetti coming in, I think actually would do good with 2-year terms. So thank you.
Any further comments from the board? Is there a motion?
Well, I just, in hearing my colleagues, I would be open to just accept the first 2 items, and if anybody would make a motion on that, or I would, and dropping the third one for now, since there's some disagreement about that. But I think the first 2 would move us ahead significantly, and I don't think it would be in conflict with, Isabel's coming on board, and she's mentioned she's, new to the area. I think it would only benefit her and our process to have both the 2-year terms as well as the kind of executive planning to plan out a year's worth of work, or as much of that as we can look ahead to.
Is that a motion?
I would go ahead and make the motion or second it, however you would like to do it,
Go ahead.
Jed. But I would make a motion that the Citizens Advisory Committee adopt number 1, having a chair and vice chair for a 2-year term. Adopt number 2, the creation of an executive committee made up of the chair and vice chair, with the Measure B project manager as staff to that committee, and that committee would be charged with developing a draft plan for a full year's work by that committee that would be brought back to this committee and approved by this committee. And I think that would close the circle on that. And I would also add that regarding the 3rd recommendation for citizen members for chair and vice chair, that be continued at a later date until next year, with a legal opinion by county council, or possibly or a policy decision by the Board of Supervisors. And that would be my motion. Thank you.
Second?
Yes, I would second that.
So I have a question to the maker of the motion or the author of the agenda summary. The next year's president isn't here, and this is like one of those things that you don't show up for a meeting, you get elected. And so we're asking her, we're basically saying that you were elected for 1 year, and now we want you to do it too. Is she aware of this?
Yes, and actually, Chair Barish and Cassandra both have an email from Member Moschetti that I think should be read into the record.
So Vice Chair Moschetti did say that she wants to weigh in on items 3I and 3J, which is next, as she's going to be chair next year, and she would be remiss not to do so. This is her statement. 3I, to my understanding, if approved, will ask for an amendment to the bylaws to extend the terms for chair and vice chair. I am willing to do so if approved.
Thank you.
Any further discussion on the board? Mr. Diamond is, no, you're. Any public comment on this item? Seeing none, I'd like to take a vote on the motion. All in favor, say aye. Aye. Any opposed? The motion passes. Moving on to item 3J. Discussion and possible action regarding scheduling a committee meeting on the coast in 2020. Ms. Riley.
Thank you. This item was requested by member Myrtle, so I'm going to put my electrician hat back on. There's only a brief statement from him in his absence. He says, thank you and sorry for not being able to attend the meeting. I should turn my thing on, sorry. Thank you and sorry for not being able to attend the meeting. It is important to include the community on the coast at least one time annually in the upcoming Measure B schedule. I have arranged for Town Hall in Fort Bragg on the fourth Wednesday of the month for either February, March, or April. The committee can select which meeting time would be best. I will finalize time and date and get the teams talking to one another about the specific needs for the meeting. Thank you.
Chair Barish, I'm going to support that, but we have to include Willits in that too. So when we're talking about the calendar year 2020, if we're going to have one in Fort Bragg, I certainly want to return to Willits and have one here. Thank you.
Is there a motion?
Before that, I would like to read Vice Chair Muschetti's opinion on this item. To 3J, I am in favor of having a coastal meeting, but request that a date not be set until I can participate in the discussion.
Ms. McGordy.
Yeah, I just wanted to share that the Behavioral Health Advisory Board meets all over the county, not just on the coast and in Ukiah. And so I think it would be good for this board to consider meeting at least in each district during the year, because we represent the entire county. And as you can see, we met in Willits for the first time today, and it was standing room only, so for Measure B, not for my board, I think you would have standing room only in other places. Thank you.
I'd like to make a motion that we formalize a request to have a meeting on the coast next year and in Willits next year. And that, unfortunately, we don't have the calendar. We know that it's the fourth Wednesday of each month with the exception of the December month. So my motion would be that we go along with Mr. Myrtle's request, but we add Willits to that. That's my motion.
Is there a second?
I'll second that.
Comment, Ms. Riley?
Can we agendize that for the January meeting so that everybody has their calendars present and we can formalize next year's meeting schedule? Thank you.
Okay. Is there anybody, any further comment? So we have a motion and a second, but we're going to put that off till the next meeting. Is that right? Or are we going to vote?
No, the motion is that we're going to go ahead
And
and acknowledge that we're going to meet in Fort Bragg
Okay.
and in Willits next year, but the calendar itself of the dates is not going to be decided until next
Okay.
month.
Any further comment from the board? Any public comment on this item?
Joe Bradley, Little River. I sat on the Mendocino County Tourism Commission, or some form of it, for 18 years. And we made a point, because we were a county board, that we met north, south, coastal, inland. Every month it changed. And some months we had a lot of people, like standing room only, and some we didn't. But we made it a point to make it all over the county because we were a county organization. And I would stress that, what Jan brought up, that be done. I know Willits is important and Ukiah is important and Fort Bragg because they're the biggest cities we have, but we have a bastard stepchild sometimes in the South Coast, and they feel like they're not included. Yes, they don't have the same meeting rooms that we have in the bigger cities, but they get forgotten, and they have the needs as we do. And I think that having one in each district wouldn't be a bad thing. We did have meetings in Boonville at the fire department. They have a really nice meeting facility there. So we did have them all around, and I don't know if because this is a county group that it couldn't be done in private meeting halls. I mean, we're in the hospital here, so, and we're using town hall at the city, but we had meetings in different places, and we found some were really, really good because they had everything we needed and others didn't. But we did find in wineries will usually, I mean, not that we're gonna drink while we're doing this, but the wineries have big meeting rooms too, so.
Chair Barish,
I'm just saying, use all our resources and make sure that everybody in the county feels inclusive. That's
Thank you.
Chair Barish, my motion certainly isn't going to exclude the representatives from the Board of Supervisors who are appointed here to come in if they have a meeting place and they could make the arrangements. I think that the challenge would be next month when we sit down, instead of putting it off until February or March, if you are representing a member of the Board of Supervisor, come into the meeting next month ready to say that you know of a place that could handle it, that would have high-speed internet, that we could live stream this and so forth. But my motion certainly doesn't exclude any other districts. Thank you.
Any further public comment? Hearing none, there's a motion on the board, on the floor. All in favor, please say aye. Aye. Opposed? The motion carries. Agenda item, agenda item 4A, committee member reports regarding items of general interest. Ms. Miller.
I have none.
None to report.
I would just like to make a request that when there are Measure B specific items that are going to the Board of Supervisors, that the Measure B committee also be notified in advance when that happens. There have been several notable items that went before the board before Measure B. And so I'd just like to make sure that we get proper notification when that happens. Thank you.
Chair Barish, as some people may be aware that Saturday the 28th is my last day as the sheriff of Mendocino County. I intend to stay very active with Measure B and actually spend more time working towards the common goals we have of improving the mental health situation in our county. Thank you.
Mr. Diamond.
Yeah, nothing new from me.
That brings us to the end of the meeting. Thank you for coming.